the other leg, you could roll this back. Yeah, and you've got most of the area there that you would need. So again, you could work that way. So just need a little bit of oil.
Right, okay, so that's good. You know what you did.
So you've done legs already?
Yeah.
What is it, things that you need to
Nothing deep though.
pay attention to the clock?
Will you put the pillows or without the pillow and
You can do.
yeah?
I mean, if I was doing a full treatment, the pillow would probably already be there. It's not going to harm her for a short treatment like this. I don't always have my leg here, it's just a bit more comfortable for me today. But sometimes I do.
It's the fact you know you're comfortable just putting your leg wherever.
Yeah, exactly. Normally I don't have shoes on either, so...
No, I'm here, this is my position.
Yeah, exactly. And you know, you can use it for certain points. I don't normally have shoes on. So
Every day.
It's not good for no shoes.
no, take these off a second. But for me personally, I might even get in like this.
Anyone
exact
else with
thing
massage journal?
with that one leg up, just because for me it's more comfortable. Okay. So drawers may be covered, things like this. Yeah, so just being careful that the wrist is in line. Is that okay, that pressure?
Yeah.
Not too painful?
No.
So again, like my shoulders are relaxed, thinking about my light, and a nice stance. So a natural progression from there might be for me to do a similar movement that we talked about earlier that I did. So you might go in a horse stance here, or you might go in that forward Tai Chi stance. Pressure okay? Yeah.
So you're using sort of just that area basically.
Can do.
This is first massage journal.
I mean, I personally do a little bit more. I don't use forearms that much on legs, a little bit this way. I also do a lot.
Unless if somebody's hairy.
Yeah, it depends. Sometimes it can pull a little bit, but I use a lot more of fist. So I sort of lock my elbow into my hip, and then I can come up here and I can go quite deep. Is that okay? Yeah. On someone with very tight IT bands, you really need to, so that your arterial band ends down there, you need regular feedback with them. Might be a little bit tender. You okay? Yeah. And again, it's just working nice and slowly. But although I have a fist, my hand isn't tight, this fist isn't tight. Because it's coming from here, I'm using my body. Again, yeah, so it's just because I'm using that in that way. And you'll find your way, you know, for some people they might prefer it's not that way, usually it's this way. But certainly this area here you can work quite good points. And nice and slow. And the key being the speed. I use this a lot.
What did they do? What did they do well? What they didn't do well?
You okay? Is that too deep? Are you okay?
No, that's fine.
Looks really nice.
Again, like the fist like this, I'm sort of using that bit there. So it's kind of getting a little bit of the bones is quite nice for that pressure, but it's still fairly broad. It's not, you know, I've not got an area where I'm just doing that or just doing that way. So I tend to use this a lot, and I don't find it tiring. So she's got an area here that we can work a bit deeper on.
Yeah, I've done that.
And you can do those things that you do with draw, maybe like this, something like that. So again, using the back of the hand. You've probably done that on the back,
Yeah.
which is sometimes nice if your wrist has got a bit tired to reverse it. Might use this side.
This one is alphabetically, like the person's family name. After the consultation, treatment.
And then I do tend to just try and connect it all just for the last few movements. just reminding the person how long their legs are and that they don't finish there. And then come down. Maybe a little bit of work around here. Even if my focus is on hamstrings, I still do a little bit around here. And that might come down. And just a slight movement. But there's no right or wrong with that, it's just one way you could finish. Okay, yeah. Any questions? Mm-hmm. So, yeah, really, it's a bit like when I was trying to explain about the back. There's no, like, that's the technique that you need to use. It's as long as your body is in a good position. And it's all very similar, so that movement that I showed you, you know, that slower flush, is exactly the same as what I'm doing here, but I just need to make sure this is all in alignment. So that there's none of this and none of this, because this would cause a strain to me. Okay, shall we have a go at that? Yeah.